Welcome to Catalyst Medhub, where we ignite understanding and make learning easier. In our today's class, we shall be discussing on the anatomy of the cubital fossa. Cubital fossa is just a triangular depression that is located at the front of the elbow joint. The term cubital is Latin and it means elbow. So cubital fossa is just a triangular depression that is located anterior to the elbow joint. That is the introduction. The boundaries of the cubital fossa. The cubital fossa is bounded medially and it is bounded laterally. It is bounded medially by the lateral border of pronator teres. Lateral border of pronator teres module. And it is bounded laterally by the medial border of brachial radialis. It is bounded laterally by the medial border of brachial radialis. So this is about the boundary of the cubital fossa. The next is the apex. The apex of the cubital fossa is projected downward and it is formed by the area where brachial radialis crosses the pronator teres. Now the base of the cubital fossa. The base of the cubital fossa is directed upward and it is formed by the imaginary line that joins the two epicondyles of the humerus together. It is formed by the imaginary line that joins the epicondyles of humerus together. The next is the roof. The roof of the cubital fossa is formed by the skin, the superficial fascia, deep facial, and bicipital aponeurosis. So these are the structures that form the roof of the cubital fossa: the skin, the superficial fascia, and this superficial fascia contains one median cubital vein. This median cubital vein is the one that joins the cephalic and maxillary vein together. Two, it also contains lateral cutaneous nerve of the forearm. It also contains medial cutaneous nerve of the forearm. The lateral cutaneous nerve of the forearm follows the cephalic vein, while the medial cutaneous nerve of the forearm follows basic vein. Those are the contents of the superficial fascia, which forms the roof of the cubital fossa. The next thing is the floor of cubital fossa. The floor of the cubital fossa is formed by one brachialis muscle, two supinator, which is round at the upper part of the radius. So the floor is formed by the brachialis muscle and the supinator. Coming down here, this diagram here shows us the boundaries of the cubital fossa. From here, this is our medial border. The medial border, and the medial border is formed by the pronator teres. And here is our lateral border. The lateral border, and the lateral border is formed by the brachial radialis muscle. Then down here is our apex. We say the apex is an area and is projected downward, and it is formed where the brachial radialis crosses the pronator teres. So here, this point here is our apex. Then the base is projected, the base is directed upward, and it is formed by imaginary one line that joins the two epicondyles of the humerus together. So this imaginary line that joins the two epicondyles together is the base of the cubital fossa. Now, going to the floor of the cubital fossa, we say that the floor of the cubital fossa is formed by the brachialis and the supinator. This muscle here is the brachialis muscle, and the supinator that is rounded at the upper end of the radius. So this is the supinator. This is the boundaries of the cubital fossa, and the floor of the cubital fossa are formed by the brachialis muscle and the supinator that is rounded at the upper end of the radius. Next thing is the content of the cubital fossa. Content of the cubital fossa. Content of cubital fossa. Content of the cubital fossa from medial to the lateral include 1. Medial nerve, 2. Terminal branches of brachial artery, brachial artery, 3. Tendon of biceps brachii, tendon of biceps brachii, and 4. The radial nerve. So these are the content of the cubital fossa: the medial nerve, the terminal branch of the brachial artery, the bicep tendon of the bicep brachii, and the radial nerve. So this structure here, this diagram here will show us the content of the cubital fossa. This is our medial border, the medial border, and here is our lateral border. I will say that from medial to the lateral there is medial nerve. So this is the medial nerve. This is the medial nerve. This is brachial artery, terminal branch of brachial artery, then followed by the tendon of bicep brachii. This is the tendon of bicep brachii. Tendon of biceps brachii, and lastly there is radial nerve. So these are the contents of the cubital fossa. The medial nerve leaves the cubital fossa by passing between the two ends of pronator teres. So this is the two ends of the pronator teres, the deep end and the superficial end of the pronator teres. The medial nerve leaves the cubital fossa by passing between the two ends of the pronator teres. These are the ends of pronator teres. But before it leaves, it gives out branches to some of the muscle of the anterior compartment of the forearm, such as 1. It gives branch to flexor carpi radialis. 2. It gives branch to flexor digitorium superficialis. Digitorium superficialis. And 3. Palmaris longus. These are the muscles in which the medial nerve gives branch to before it leaves the cubital fossa. That is for the medial nerve. The next one is the brachial artery. The termination of the brachial artery and the beginning of the radial and ulnar artery all lies in the cubital fossa. This is the termination of the brachial artery, and this is our radial and ulnar arteries. We said that the termination of the brachial artery and the beginning of the radial and ulnar artery all lies at the cubital fossa. Now, the radial artery, because the brachial artery terminated by the radial and the ulnar arteries. The radial artery is smaller and is more superficial than the ulnar artery. The radial artery gives off a branch called the radial recurrent artery. Radial recurrent artery. While the ulnar artery is deep than the radial artery, and it goes deep to the end of the pronator teres. It is separated from the median nerve by the deep head of the pronator teres, and it gives off the following branches. 1. Anterior recurrent branch. 2. Posterior recurrent branch. 3. Common interosseous branch. This common interosseous further divided to give anterior interosseous and posterior interosseous arteries. So this is about the brachial artery in the cubital fossa. The next is the biceps brachii, that is the tendon of the biceps brachii, so located at the cubital fossa. And lastly, there is radial nerve. Radial nerve descends medial to the lateral epicondyle of the humerus before it enters the cubital fossa. And in the cubital fossa, it gives the branch which is called posterior interosseous nerve, also called the deep branch of the radial nerve. And this nerve gives off the branches to two major muscles. The supinator, it gives off branches to supinator and extensor carpi radialis brevis. So this is about the radial nerve. The radial nerve descends medial to the lateral epicondyle of the humerus before it enters the cubital fossa. And in the cubital fossa, it gives off posterior interosseous nerve, also called the deep branch of the radial nerve. And this nerve gives off the branches to two major muscles, which are the supinator and the extensor carpi radialis brevis. The next thing under cubital fossa is the clinical correlation. The clinical correlation of the cubital fossa includes 1. IV infusion. Intravenous infusion is basically carried out at the cubital fossa on median cubital vein. Median cubital vein is used for intravenous infusion. It is also used for the cardiac catheter to withdraw blood from any chamber of the heart. Next one is blood pressure. Blood pressure is universally recorded by auscultating the brachial artery in front of the elbow joint. The next one is the cubital fossa is very useful while dealing with the fracture around the elbow region, such as the supracondylar fracture of the humerus. So this is about the cubital fossa. Kindly subscribe, like, comment and share. Don't forget to turn on your notification bell so that you don't miss any new video.